clinical doctorate. Retiring as a first responder, law enforcement, I saw a lot of my peers going through a lot of issues like PTSD. So when I left the department, I decided I wanted to help my fellow officers with their struggles. And it's mostly not only the everyday wear and tear of law enforcement causing what we call complex PTSD, which is multiple instances throughout time, as in like a career accumulating to cause harm and ill effects to the patient, right? For example, my patients that I had were usually post-incident, meaning they shot and killed somebody or their partner was killed, and they have struggles with how to cope afterwards, and they come to me. So it's because of my previous career in law enforcement that I developed a passion to help my fellow officers, that I became a doctor in clinical psychology with a focus and emphasis on first responders and treatment.
Okay. What is your favorite aspect of your occupation?
Helping others, making a difference in bringing heroes back to a life that is a good life for them, their family, and also for the citizens that they serve. They have to be well, they have to be healthy emotionally, healthy cognitively, in order for them to perform a job that is very dangerous and high risk, and also with immense influence on the community.
Okay. If you were to go back and pursue a different medical occupation or specialty, what would it be and why?
Psychiatry, because I realized in clinical psychology there's a lot of aspect of the brain chemicals, the brain structure that I really don't understand enough, and also the medicines that affects the symptoms of what I see in clinical psychology really needs to be addressed through psychiatry, because the trauma that comes with first responders, i.e. PTSD, is heavily based on the chemicals in the brain that causes the effects, for example, anger, irritability, anxieties, depression, vulnerabilities, fears. Yes, there is a clinical perspective, but you have to also understand the chemical and the organic organ of the brain that causes and is it's almost like different parts of what I used to call the elephant. You know, you have to know a little bit of the brain in order to deal with the practical living within that brain.
Okay. And what challenges have you faced in college, and how did you overcome them?
Well, a doctoral program is a doctoral program. So I went through my bachelor's program, which is what this assignment is asking. Within the next 5 years, I got a degree in sociology, social work. Okay, from there, social work, I went to law enforcement. After law enforcement, I went into a master's program and also seminary, and I was going to be a therapist to help first responders. But as a therapist, there's limitations on what I can do. So instead of going as a master's, I went and got my doctorate so I can be a clinical psychologist, more knowledgeable working with first responders.
Okay.
Mm-hmm.